Hello, my name is Amira Jasni, and I will be presenting about the introduction for our case studies. Uh, okay, okay. What is counseling? Counseling is a profession that involves with helping people, which is the client, to overcome their emotional pain, mental health concern, without being a judgmental. It doesn't matter. Doesn't matter the client age or religion, sexuality, culture, and disability. The counselor should be remain a professional at all the time and sticking to the equal opportunities in ACTA, but also be true to their own limitation. A counselor has their right to be have their right they have a limit, meaning the counselor can it's not like terminate but can stop the session if the counselor is feeling or the client is not being comfortable in their session. Okay, what sorry, why is ethics important for counselor? It's very important for a counselor to have ethics because it helps to protect the welfare of the clients and counselor. uh, sorry, because and ethics they provide something that for example if a client have share their problems and their topic is kind of sensitive, we have to be a professional and be ethical, right? Provide them some comfortable environment and try to be friendly. And an ethical is an essential for making sure that the client well-being, maintaining their trust, complying with the law, and keeping the specific identification of the profession. Okay. For the next question, for the third question, what is the purpose of using Malaysian Counsellor, Akta 580 and Code of Ethics? Okay. It provides a guideline for a counselor, ensuring their professional codes of ethics and the well-being of a client is the same of like the iris plane of the ethics. And it's very important for maintaining the quality of and effectivity of the counseling service by ensuring the counselor are qualified, a counselor are qualified, regularly and adhering to high ethical standards. Okay. So that's all from me. I will pass it to Joe.
Greetings to Madam Ifa. So I'm going to talk about the case summary here. So the article discusses the issue of mentally ill individuals being exploited by unaccredited online counseling services. These services charge large sums of money for therapy sessions conducted through online chats, often with untrained counselors who may exacerbate the client's conditions. There is currently no legal requirement for therapists to be members of a professional body, leading to a wide range of individuals calling themselves counselors. The lack of regulation in online therapy is a serious concern because as vulnerable people can be taken advantage by unqualified practitioners. The article also mentions that the rise in webcam and instant messenger appointments offered by the National Health Service as an alternative to face-to-face therapies. However, some experts argue that these online services may not be suitable for individuals with higher levels of distress. So moving on to the next one, which is issues. The issue. Okay, the progress of technology has significantly influenced the field of mental health, with the emergence of online therapy as a convenient option for individuals seeking counseling. And as you can see, there are seven issues. Okay, rise of online therapy, exploitation by unaccredited therapists, lack of regulations, negative user experience, risk of unregulated online interactions, and National Health Services role, computerized CBT limitations, and urgent need for action. So, as you can see, um, an article published in the Independent has shed light on the concerning exploitation of vulnerable individuals, unaccredited online therapies, and these therapies operating on private platforms are found to charge exorbitant fees for their services without processing the necessary qualification and expertise. The absence of a stringent requirement for professional accreditation allows individuals without proper training to assume the role of counselors, potentially harming those in need of genuine support. And former users of these unaccredited online therapy platforms have reported negative experiences because citing instances where abrupt billing practices and the promotion of personal beliefs by the therapists have aggravated their mental health issues. The lack of oversight in the online therapy sphere had led to a situation where vulnerable individuals seeking help are at risk of financial exploitation and emotionally harm rather than receiving the necessary care and guidance. Furthermore, the article raises concerns about the role of National Health Service in exacerbating the problem because the National Health Service has increasingly directed patients to utilize webcam and instant messenger appointments as an alternative to traditional face-to-face therapies. While this approach aimed to be provide accessible mental health services, the lack of regulation and oversight in the online computerized oversight in the online therapy, domain poses a significant risk for individuals seeking support. And the reliance on computerized cognitive behavioral therapy programs, which may not be suitable for everyone, could discourage individuals from accessing more appropriate in person service. Addressing the pressing issue of the vulnerable individuals being exploited in unaccredited online therapy is imperative. To ensure the protection and well being of those seeking mental health support, it is essential for policymakers, professional bodies, and the mental health organizations to work collaboratively in establishing robust regulations and monitoring mechanisms, implementing accreditation requirements and rigorous oversight of online therapists will help safeguard the integrity of mental health support services and prevent the exploitation of those in need. Moving on to the next part, which is content. This is the Counselling Act. So, the emergence of online therapy has provided individuals with convenience access to mental health support, and there are the Counselling Act 580 and Professional Counselling Ethical Codes. And the Counselling Act 580 likely outlines the qualifications and requirement for practicing as a counselor, analyzing the articles involved, assessing whether the online therapies mentioned meet these standards. If the therapy lacked the necessary qualification or accreditation, it would be a violation of the Act and ethical codes because unaccredited therapists may lack the proper training and expertise to effectively treat serious mental health conditions, potentially causing harm to vulnerable individuals seeking help. And the Counselor Act 580 likely emphasizes the duty of care that counselors have towards their client. Analyzing the article requires assessing whether the therapists fulfill their duty of care and exploiting the vulnerable individuals by charging exorbitant fee or providing inadequate treatment would be a breach of the act and ethical codes. Therapists should prioritize the well-being and the best interests of their client, ensuring they still receive appropriate support and guidance because professional counseling ethical codes typically stress the importance of maintaining clients confidentiality and privacy, Analyzing the article involves considering whether the online therapist respected this principle. If therapists disclose client information without consent or fail to implement secure communication channels, it would be a violation of ethical codes. So, ethical codes provide guidelines on maintaining appropriate professional boundaries, because analyzing the article requires assessing whether the therapist adhered to these boundaries. Exploitative practices such as imposing personal beliefs or engaging in financial exploitation would be contrary to the Counselor Act 580 and ethical codes. Therapists should establish clear boundaries to maintain a professional and therapeutic relationship with their clients, avoiding any behavior that could harm or exploit vulnerable individuals. Analyzing the content of the article in light of the Counselor Act 580 and professional counseling ethical codes reveals several potential violations: unaccredited therapists, lack of duty care, breaches of confidentiality, and inappropriate professional boundaries are all concerns raised by the article. It is the imperative for policymakers, professional bodies, and mental health organizations to address these issues and establish robust regulations to protect individuals seeking therapy online. Ensuring adherence to the Counseling Act 580 and ethical codes will safeguard the well being of the clients and maintain the integrity of the counseling profession. Thank you. Now, I would like to pass my time to Amira.
Okay, thank you, Edwijo. For for my part, discussion for improvement. The based on the case of studies, counselor should follow Akta 580 because in the Akta Section 2020 of this Act provide for the registration of allied health professional, including counselor. It is ensures is very is is no, sorry. I'm sorry. It's very important for the counselor to be registered under this act to practice legally and ensure they meet the necessary professional and ethics in this case. Counselors are required to be registered or licensed to conduct a counseling session legally. This is to ensure that the counselor meets certain standard of education, training, and ethical conduct to provide quality and safe service to the client. And it also helps the client to protect their rights and well-being of client. Because based on the case study, the client didn't feel satisfied there with their counseling session because a counselor being a judgmental, and they provide a theory that is not perfect for the most of the client because CBT is are not some CBT can use some of the client, but if the client issues are very intense, it's better to use another to use other theories. If not, the clients will be confused and they won't solve their own problems because we as a counselor has to be a guidelines and provide a better theories and guide them to 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 solve the problems. and and based on the case of study, the classes should provide a fair and visible fees because it's important to strike a balance between covering their own costs and making counseling service better is accessible to those who need them. The cost of counseling service are based on counseling qualification, and yeah, the counsel should be fair because some of the clients could not provide. a session that is high space because it's making the guys feel not fair because they are coming for guidelines to solve their problems, but we constantly provide a very high pace, so it's not really good for the counselor, and it's against the law. Yeah. Okay. For the conclusion, is that we as counsel should provide a fair and reasonable fees for the survey because keep it so that it will keep the well-being of the client, and it's important to strike a balance costs and making council service more, a comfortable environment so that we as council have to be making an environment comfortable environment to the client. Even though we doing an online session through a camera, a counselor in based on the factors already, the counselor are being judgmental, and we as counselors should not be judgmental. We have to accept them for who they are and being fair with being fair with client so that the client is satisfied with our service. So that is all for me. Thank you.